Hello, and welcome to the Health Go Live webinar series. Today's episode is brought to you by our friends at Trellus. We would like to remind you that the Q&A feature will be available, so feel free to send in your questions for our speakers throughout the discussion. And with that, I will turn it over to our moderator who joins us from University of Miami Health System, Maria Abreu.
Thank you so much. Well, I'm so delighted to be here. I'm going to introduce myself, but introduce the most important part of this program, which are these three wonderful women that I have the pleasure to interact with today. My name is Maria Abreu. I'm a gastroenterologist, a physician scientist at the University of Miami. Although by way of full disclosure, I'm actually in Rome at the moment, so the power of technology. And I'm actually here because I wanted to learn more about the microbiome and needed like the space to have time in my life to do that, because every day I take care of patients with Crohn's and ulcerative colitis. And although we've had this monumental improvement in the therapies that we use, in point of fact, the most important things to patients are things that we can't address in our current conception of how we deal in healthcare. At least at the physician level, and what patients want is time, our time, and feeling better about themselves more generally. And so we have put together this wonderful program to talk about this aspect of positive psychology and the role it plays in chronic illness. Obviously, Crohn's and ulcerative colitis are important, and are important chronic illnesses that affect people at all stages of their life. And we have three wonderful panelists that I'm joined by. The first is Angelica Catalano Sanchez, and Angelica is a graduate of Cornell. She works on social impact partnerships with large nonprofits and media companies, and is promoting a book for children and doing things about, with pediatric patients, and is going to talk to us about her take on positive psychology and how it has affected her own journey. And I won't give away any of the deets. And then we have Leona Brandwein, who's at the University of Pennsylvania on the faculty as Associate Director for Penn's Master of Applied Positive Psychology. And so she, is very busy actually educating the next generation of people that will participate in positive psychology. And I think this really kind of informs all of the different chronic illnesses that we deal with. And then Laura Kiefer. Laura is an academic health psychologist. In my world of IBD, when we think of a psychologist, we think of Lori Kiefer. It's a monosynaptic relationship. And Lori has, through very careful studying, developed techniques not only to improve this positive psychology, but to improve the resilience in people that have IBD, and has demonstrated actually in well-controlled studies that this has an impact in lowering admissions to hospital and ER visits simply through having people develop improved resilience without any change necessarily in their medical therapies. So these are the great women that we are going to hear from today. But we're going to begin with Angelica, because she's really going to lay the groundwork for us about why this whole conversation is important.
Thank you so much, Maria. As Maria said, I'm Angelica. I have had IBD for over 25 years and only recently achieved remission in the past few years. Since I was a child, I really exhibited a lot of qualities of resilience and positive psychology without really knowing what it was. I was hospitalized at age 6. Luckily, I had a really supportive family who made getting out of the hospital really as good as it could be. I actually had a lot of gratefulness early on in life. I savored just the small things like going to school and being able to eat food after being hospitalized. So really that outlook was unique at such a young age. I also really benefited from a lot of the creative activities that my brother had brought to childhood, really got lost in writing and music and making movies and those sort of fun things. So I felt I had a really happy childhood despite living with this illness. Now, when I went to college, I still very much was in a low-grade flare-up throughout it, but I actually studied positive psychology and learned that I had been a resilient child and kind of took a deeper dive at what positive psychology was all about. I didn't continue into academia, but I actually wanted to go into health media to really tell stories of people like myself that live with a chronic illness and to explore all the aspects that help maintain well-being when you're physically so ill. It took a long time. As I said, I actually got worse before I got better. I had a moment where I had needed an emergency surgery, and I had just been working full time. I really had been, complaining here and there about pain, but really at this point, pain was just something I tolerated so well that I didn't speak up enough and found myself really just in a bad situation. I recovered. It took a long time. I had an abscess and decided that I needed to take a break from work. I thought, that I had been still thriving because I hadn't missed out on work, but really not only was my physical health still not good, but my mental health for the first time took a really big hit. I developed panic attacks, and not working, just gave me some time to really say once and for all, I would try to make physical health my top priority. And I did that at Mount Sinai with Dr. James Marion. About the time we started finally zeroing in on the treatment plan that would achieve physical remission is the time that I started therapy specifically for people that have IBD and with this positive psychology framework. So that is when I started truly practicing what I preached when I was studying in college. I had lost sight of some of those really key tenets about making sure I had, creative outlets, that I could get lost in flow, making sure as I was putting my job first, that I was putting myself first, keeping those connections to people I loved in my life, and moving closer to family, those sort of things. So I finally made it to physical remission, and that doesn't mean I'm letting go of my mental health care. I would say to patients who think that they don't need any sort of mental health care, not only do you need it, but you need a personalized approach that really works for you and is specific to the kind of physical health journey you're on. So definitely speak up and don't lose sight of your mental health when you are taking care of your physical health, because they go hand in hand a lot of the time.
That's great, Angelica. Leona, maybe you could follow on and explain to us a little bit about the tenets of positive psychology, and in particular, what strikes me is that this very talented young woman, okay, she was sick with her IBD, but it almost seems like it was in equal parts that she needed to take time off for things that were, from the neck up in terms of getting her better, and that's why she was actually missing work, right?
Yeah. So first of all, Angelica, your story is an amazing story of resilience, and I think it illustrates so many things that are typical, right, or embedded in the experience of somebody with IBD. You used a couple of words in there as you were talking about mental health. You used the word well-being. You used some other words, right, that were related, and so we can really think of mental health as an imperfect metaphor is kind of a continuum, right? And people often move fluidly along this continuum based on, different aspects of their life. And particularly sometimes when hardships are inserted in our lives, we have a tendency to move toward, one end or the other of the continuum. So I wanted to just call out this distinction, and especially the word mental health, right? Sometimes it's almost a euphemistic term, right? And what we're really talking about in those moments are something that would be more on the clinical side, right? That would fall into a mental illness when somebody is experiencing a disorder like panic attacks, et cetera. And I think that there are these other words that you used, right? Well-being and flourishing, which are really what we often say is like what's north of zero, right? Because often the things that you described around having positive experiences, having a sense of purpose and meaning in your life, developing and strengthening the relationships that were in your life. These are things that add something above and beyond merely the 0 point. So just as, we're all familiar with the WHO definition of health that says it's more than just the absence of illness, we can apply that same metaphor, I think, on the mental health side. And we can say that flourishing and well-being are something that's more than merely the absence of mental illness. So, importantly, some of those things I think I would call out. Lori, I know that you've been engaged in this work for some time, and particularly thinking about things like related topics like resilience, right? Which I'm cautioning about like just saying that, you know, well-being is only the sunny side of life and only when we're doing well, because I think that many of the skills that we talk about that are related to flourishing and well-being often are skills that we leverage at times when things are quite challenging. So Lori, can you talk a little bit? I know you've done a lot of work with regard to resilience and particularly with people with IBD. Can you share a little bit about some of your experiences?
Yeah, absolutely. I mean, I think that Angelica's story is exactly kind of what we're wanting to build in our patients, right? Leveraging their existing strengths, recognizing that over time, as transitions in life happen, that we're vulnerable to having to learn new skills or take a step back or rejigger our approaches, right? But always with that idea of that growth mindset, right? What can I learn from? You know, if I have an abscess and a surgery, what can I learn from that? What did I learn about myself, and how can I become you know, the next version of myself, my 2.0 self. And so I think that that's really what we've tried to do at the IBD Center at Mount Sinai, is really kind of flip some of the conversation that us gastropsychologists have around sort of screening patients, like, are they depressed? Are they anxious? Okay, refer to the gastropsychologist now, but really sort of starting at a much earlier point where you're creating this culture of well-being. How are you doing, right? And I always say you could have a well-being review of systems, right? Asking patients at every visit, what are you, what's going well in your life? How are you managing things? And really kind of keep that conversation focused on how the mind and the body are connected. Now, in gastroenterology in particular, I think I mean, this is why I became a gastropsychologist, is that you can't really separate out the brain and the gut, right? And so we have an opportunity here to not separate out medical care and mental health care or emotional attending to it. And so that is what we've really tried to create here at the IBD Center. And as Maria had mentioned, when we created that resilience culture with all of our patients in the center, not just those with mental health concerns, we were actually able to improve their outcomes. And, you know, I know we were kind of throwing out the word resilience, but, you know, resilience is a way of framing this, but it's really about those disease interfering behaviors, right? It's the not taking enough time for yourself. It's about not being able to make your appointments, take your medication, ask for help when you need. And that's why when we build resilience, we're really kind of focusing more on how that translates into being able to flourish as a person living with a chronic condition.
Yeah. Beautiful.
Lori, do you think that in your experience, there's any patient that wouldn't benefit from this? In other words, you know, because I think there's the tip of the iceberg phenomenon. Like, you know, I also am fortunate to be in an academic center, a tertiary referral center, where all we do is IBD, right?
Yep.
And so we have, every patient is going to meet with the dietitian. Every patient can meet with our clinical psychologist. They often don't choose to, actually. That's a kind of another interesting subplot that maybe has to do with culture, with cultural norms and so forth. But do you think that there's anyone that wouldn't benefit from this? And, you know, I mean, obviously all I know is about IBD, but I was allowed onto this call anyway. But, you know, you're dealing with a broader array of GI illnesses.
Yeah, absolutely. And again, going back to brain gut, I mean, I think, you know, physical resilience as well as psychological resilience are really two sides of the same coin, right? How well do you bounce back physically from a disease flare, from food poisoning, from a surgery? Your recovery is really tied to your physical resilience as much as it is tied to your mental resilience or emotional resilience. And so I think that's exactly why everyone should be focused on resilience, and again in that broader term, because there's really no way to separate that, you know, mind and body. And I know Leona and I have talked in the past about just this concept of inflammation. I don't know if Leona, you wanted to talk a little bit about what you've seen in other chronic populations, to Maria's question around just sort of that process.
Sure. So I think that, out of necessity, right, as humans, we categorize things into different buckets, and we tend to think of mental things that are related to our mental health or to flourishing and well-being as being something that resides somehow in our head, right? And that things that are physically related are only manifesting from the neck down. And I'd say that that's a bit of an artificial distinction that we've imposed on it, because honestly, so many of our mental processes are whole body experiences. So even just the simple experience of a feeling, right? Most people, when they feel angry, can think about the physical manifestations of that feeling. It's actually a physical manifestation, right? By the same token, I would also suggest that, when we think about mental illness, right, and some of those clinical states, 5 of the 8 diagnostic criteria for depression are actually physical manifestations. It's fatigue, it's slowed movement, it's weight loss or weight gain, it's sleep disruption, right? And so, you can think about this in a number of ways, but inflammation, right, is linked to so many disease states, particularly to IBD, right? But it's also linked to some of our mental health states as well. And so when you think about it, if we're experiencing depression, which is associated with inflammation, right? If we're upregulating some of those inflammatory biomarkers are influencing the whole system, right? So so from a physiological perspective, they're connected. But the second piece of it, and this is something that I saw in Angelica in your story, is that there is one of the key features of depression or of anxiety, and it has its cousin anxiety, is behavioral inhibition, right? So when people feel depressed, it's a whole body experience, and they become more passive when they're depressed, or if they're anxious, they become more afraid to act. So when you're depressed, you don't think it's going to do any good, so you just don't even try. When you're anxious, you're afraid to act because you might actually cause some harm. And that's really meaningful for someone who needs to actively and proactively an ongoing chronic condition and engage in health protecting behaviors. So somebody who is flourishing and feeling that sense of purpose and feeling capable in the face of adversity, they are that sense of agency that you have over, I can manage my life outcomes, means that you're going to take action to manage your life outcomes, and you're going to manage your chronic illness as well. And that's very different from kind of the passive state that people take when they're in a state of either dysphoria or feeling very unhappy. Angelica, I'd be curious within your experience, because I know that you've been on both ends of this continuum,
Right.
Of how that felt for you.
I think there was a lot of denial at different points, and of times when I would speak up and not being heard, and then not wanting to speak up again. So I have been on all sides of that. I will say that speaking up about invisible illnesses, whether it's IBD or otherwise, it's difficult, because when someone can't really see it, it feels like less real to them. So you really do need to make that effort to go out of your way to advocate for yourself.
Yeah, and I think that that's exactly right. I mean, you have, so much of your care for IBD, it happens outside of the office visit, right? You're managing it 24/7. Maybe you're seeing your doctor a couple times a year, but the rest of your life is also impacted: your work, your relationships, and all of that, and really being able to make sure that those areas are always kind of happening in the backdrop as well.
Yeah. Lori, I just want to take a second to tell the audience that, in fact, there's a Q&A button at the bottom of your Zoom screen to send us questions. And one question that we have from the audience is whether there are validated instruments to measure resilience and to identify gaps in resilience specifically. I didn't pay them to ask that question.
That's amazing. They set me up. So one of the things that we really had to do in the IBD Center to be able to manage our volume of patients with this resilience framework was to really make sure that we were always contextualizing our patients based on their mental and physical health. And so we actually developed and validated a tool that basically takes a patient's resilience and outcomes across medical, nutritional, mental health, independence, and social determinants of health to really sort of make sure that we're all people, all the multidisciplinary team members are looking at the patient through the same lens. And this is because a lot of times we really overwhelm our patients with recommendations. We're like, go see the therapist, go see the dietitian, go see the physical therapist, do the massage. And, while I think it's all well-intentioned, it's so much more helpful when we as a team can say, all right, we've assessed this patient across all these domains. What can they do first? What can they do second? What might interfere with this versus that? And so, we created a clinician administered instrument that cut across all of our different, specializations, a scoring system. And then that was really how we determined who got what services, who needed what services, and who how to coordinate and track people's care. And that has since been, because of its efficacy and its use, it has been licensed now to Trellus, which has taken it and really digitized it and made it into a experience for all patients, not just the ones at the IBD Center.
All right, can I mention what an unusual approach that is, right? So often when patients come in to see their clinician or their care provider, they get sliced and diced into my area of expertise. And if it's not in my area of expertise, I'm going to push you off to the next area of expertise. And that's frustrating on the patient side, because that's not how life is experienced, right? IBD is experienced 24/7. Mental distress that may go along with that is also experienced, 24/7. Plus, so if you are somebody who has IBD and you're experiencing some mental distress, you're not just doing that in the doctor's office, you're doing it at work, right? You're doing it with your family at home, you're doing, your sleep is disrupted. So it's really impacting your life. And I think that that's such a unique approach because it's so contextually attuned. And it's based on what the patient's experience is like and how to really support them 24/7, as opposed to only supporting them in that 15 minutes that they get to see their provider.
Right.
Well, I think that also speaks to, and I'm here to, maybe my role is to defend the doctor role. And what I mean by defend, you can imagine, in order to see whatever your specialty is, whatever one specialty is, there's the reality that we have this limited time of having this meeting where you both need to help with what I know, sounding old school, medical issues. What are the kind of the things? What is that? Does Angelica need to change your medications? All of that, and also achieve intimacy and have someone trust you all in that span of, my visits are scheduled for every half an hour for news or follow-ups. That's an awful lot of time. Actually, it's a whole lot more time than if someone was in a typical practice where they're seeing, a variety of, whether it's heartburn and irritable bowel and IBD, right? All mixed in together. And so half an hour is a luxury. Most doctors don't have half an hour, but there's a lot to accomplish. And so I just wonder what your thoughts are generally, because, I should say that this is also coming from one of our audience members has asked about her daughter who's got a chronic illness, and the mother feels that she needs help with this, that she's depressed and, is having issues, dealing with transitioning to a positive mindset in the face of what is not good, right? And so the specifics of what that illness is, I think, are less important. But again, it's obvious that the person who's asked the question's daughter is going to healthcare all the time, is interfacing with healthcare all the time. And I'm confident nobody in the healthcare setting is addressing these issues, right? So and in that way, maybe Leona, how do you guys deal with it at Penn? Do you have a, kind of a way that you embed this in every setting of clinical care?
So, Maria, if I might speak up in defense of physicians, right? Since you said, is that we've structured interactions in a way where all the responsibility is foisted, right, upon the physician, and you have, as you mentioned, a generous allocation of time in a half hour, but it's still just a half hour in order to like address all of these these comorbidities and this multitude of issues that you're trying to manage. And it's frankly almost like a Sisyphean task, right? Because it's impossible to accomplish all of that in that time. And I think that that's why, we've seen this proliferation of apps that are available that support mental health. And by and large, I think that that's been a wonderful thing. In my opinion, in some ways, it democratizes, right, the ability of people to be able to access support for well-being as well as mental illness support. And so there has been this huge proliferation. And I'll just say, my opinion personally is that those have done well and they've gathered the low-hanging fruit, right? And now we're looking at like next level integrations, which are the types of support that, Angelica, that you need in your experience, because it needs to be contextually attuned and related, to your experience, as opposed to something that is kind of separating your mental health away from the experience that you have in managing your physical health too. Can I mention one?
I think that's right. Oh, go ahead. Go ahead. Sorry,
the
Leona.
person who had reached out about her daughter who was really struggling. So one thing I'll say is we as humans have our lives are a continuum, right? We're playing the long game. We have a longitudinal approach to thinking about well-being, and there are moments in our lives where it's not simply a snapshot from day to day of just put the check in the box. I'm well today. I experienced well-being today, right? It's about really being able to knit together a life over time that is able to be responsive to the natural ups and downs that go along with whatever hand we've been dealt, including something like IBD. So I just wanted to mention this idea of prevention and promotion, because I think that that's a lot of what Lori has been involved in the support that she does. I think often we think about prevention as preventing somebody from experiencing mental illness. And I'll just apply a metaphor. It's almost like stopping a downward spiral, right? So when we think about downward spirals of thought and mood, those can lead to distress and eventually withdrawal, and then eventually mental illness. And so the ability to interrupt some of those downward spirals is really what prevention is about. I think what Lori has done, in addition to the prevention piece, is the promotion piece. And so the promotion piece is really about, and I heard some of this, Angelica, in your story, about creating some of those upward spirals, right? That flourishing is something that's above and beyond. And so, aside from just merely eliminating negative phenomena, how we integrate some positive phenomena into our lives, positive mood, right? A sense of vitality, a sense of purpose, that efficacy that we get when we realize that we hit a rough time with our IBD and we like managed it and came through it really well. I'll also say that there is some exciting research that's actually emerging from Harvard and from the University of British Columbia, that there are perhaps even protective effects, right, from some of these upward states that are something above and beyond just the absence of mental illness. So I just wanted to say, mention that, because Lori, I know you've done so much about not just helping people to respond to the hard times, right, but also to kind of build on their strengths and achieve a place of flourishing, which also has such great potential to be protective.
Yeah, and I think that that's exactly where it's relevant, why we're able to see outcomes that, maybe more traditional stakeholders might care about around cost and unplanned utilization is that when we have patients in that upward spiral, they don't have that behavioral disinhibition, right? Inhibition. They're always working to be better. They're always trying to figure out what they can keep doing to promote their well-being, right? They feel that they're thriving. They feel that they're working. They feel confident that whatever comes their way next may be hard, but there is this, they have that upward spiral framework. And it really does change how easy it is to manage your disease, right? Because we see a lot of people who, unfortunately, in the downward spiral state are really, it just translates right into not going to the doctor, not telling anybody, taking opioids, not wanting to come off. We see a lot of patients who will not want to come off of their prednisone, even though we're trying to taper them. I mean, there's a lot of behaviors that go along with managing these chronic conditions that we rely on the patient to do. And if they're in a downward spiral, we just keep getting further and further behind the 8 ball. And so promoting that positive, and Angelica gave examples of support networks, of accepting her disease, creative outlets, savoring the positive moments, having gratitude, those are those upward spiral types of things that we want our patients to have, so that they can not only apply it to their disease, they can apply it to themselves and to other people, right? That self-compassion and all the different hardships that are coming. We really just want to promote that even if they have an IBD, if they have a chronic condition, doesn't matter, right? You can flourish.
Absolutely. And the buffering effect of those, I think, is so important because it does, create this protective effect for people, and almost like a reserve, right, of well-being, so that when those hard times hit, because they will, right, there's going to be hard times no matter what, we can hopefully attenuate the frequency of those hard times. But when the hard times inevitably will hit, because you can't eliminate them all, that you have so many more resources, right, to be able to respond and to handle it capably.
Actually, there are several really amazing questions in the Q&A. First of all, I mean, one of you alluded to the fact that there are now, obviously it's recognized that we need to deal with this dimension of patient care, and that in most traditional physicians' offices, this doesn't occur, right? And to your point, Leon, I really like the concept of democratizing this, right? Because, as we all know, it's extraordinarily clunky in our healthcare system to get the appropriate care for people. And so in this space, and I don't want to even say mental health, these are not necessarily, as you now rightly pointed out, these aren't necessarily people that are anxious or depressed, but rather that we want to intercept them. We want to make them, kind of, if they're doing well, can they do better? And have them be ready for that next flare in whatever the disease state is. So there has been this like proliferation of different apps. I just bounced off before coming on this one from a great talk. There was a cardiologist, and she was talking about diets. And even within the space of intermittent fasting, she was saying like there are all these nuances, and it's up to us to be able to tell people what's the right one for their disease state, right? Like in the theme of diet. But now that I'm talking to you guys that are knowledgeable about this other space, like what are some of the effective ways to kind of change disease interfering behaviors? And are there some that are better than others, some strategies that are better than others, but really with data behind it? I'm data driven. That's why I'm here.
Yeah.
Laura, you were first.
No. Well, I mean, I would say that, I'm kind of looking at it more granular from the IBD Trellus methodology, right, where we are really trying to sort of sandwich both the really kind of customize the experience so that people who can get what they need when they need it, right? So, but yet that said, there are some skills that we think that everybody should start with, even the playing field, right? Everyone should have certain things that they start their journeys with that we want to foster and promote. And then the rest is skills training and self-confidence, right? It's around getting the care when you need it. And so in our methodology, we're really working on things like promoting disease acceptance, promoting hope and optimism, promoting those things that we know scientifically in the 20 years that I've been studying IBD self-management. These are characteristics of patients like Angelica who do well, right? Because our biggest question in positive psychology is, what are the strengths that somebody has that allows them to thrive despite adversity, right? And so how do we bottle up Angelica's story and give it to somebody who maybe doesn't have that strength? And so we have this sort of evening of the playing field so that all patients start with this framework. And then from there, we can train people in pretty much anything, right? You can get people to do anything that they need to do. They can rise to any occasion if they have that underlying sense of resilience and and what we kind of call our resilience 5 targets at Trellus.
Beautiful. Yeah. It's a feature of the human condition, right? That we have cognitive biases in how we respond to stimuli in our environment. Some of those are things that we acquire along the way culturally, right? Some of those things are just how we're hardwired to be, but it is a feature of the human experience. And sometimes those are beneficial until they're not, right? And we have those moments, right, where you experience a hardship or adversity, and how you respond to it, right? Your explanatory style of, oh my goodness, I'm having this flare. This always happens to me, right? Why does it happen to me? It's never going to get better, right? Some of the self-talk that we can engage in can translate into how we respond. You might think, right, that somebody who says, oh, I'm having this flare, but I had something like this a couple of years ago, and I came through it. So I think I can do it again this time, right? And it happened a couple of years ago, and then it receded. So I know it's not going to be this way forever. Even some of those responses to be accurate in your assessment, as opposed to being catastrophic in your assessment, is really a key feature of your ability to navigate, even for somebody who doesn't have IBD, at the natural ups and downs of life, right? And so being able to almost have a set of tools or a skill set in how to navigate how your brain works, right? Understand where some of your tendencies to have weak moments might be, and how you might buffer yourself in those moments, I think are really meaningful for people in these situations.
Lori, you alluded to optimism and hope. Are these things that you can actually teach someone, sort of improve someone's titers of hope and optimism? And is there like a sort of a tachyphylaxis over time, or kind of a recidivism of older behaviors over time? What's been your
that's the beauty of these, disease self-management behavioral skills training, is that they're not medication. So when you stop them, they don't go away, right? The benefits don't go away. These are learned behaviors. And for the most part, when you learn a behavior and you are reinforced for that behavior, so you know what, I'm normally a glass half empty person, but that doesn't work for me anymore, because that just makes me feel miserable and disabled and not wanting to go to work. So I'm going to have to change that approach, and so that I can continue moving on. And as Leona was kind of saying, the concept of learned optimism, which is that, changing how you attribute the causes of good and bad events is very much dependent on whether you see them as permanent, pervasive, and personal, right? And so you can actually get people to break those things down, teach that. And the brains are plastic. Our brains change over time. Like, once you start to see the benefit of thinking that way, there would be no motivation to go back to thinking the dark way. So I think that's the beauty of these self-management skills training that we're offering, is that they last and they apply not just to like a flare, but to a transition. Maybe you want to get pregnant with IBD now. Maybe you're going off to college with IBD now. How are you going to sort of change your attribution style to feel hopeful and confident to be able to do that? So I think that that's the difference in a lot of ways between just providing psychotherapy right? Where you're like, okay, was that, bowel accident really a catastrophic event or not? This is a totally different, it's a totally shift into sort of how am I interpreting events? We're getting at the mucosal layer here, Maria, of healing, where we're really, healing much more deeply than just sort of the clinical level.
That's great. There are some other questions from our audience that, again, it seems like we have family members that have logged in the hopes, I think, of helping someone that they love with a chronic illness, and wanting to know if there are articles or studies that can help guide them with respect to resilience and positive psychology, and so in the hopes of making them, making their relatives better. The other question that I liked, excuse me, I like all the questions, but the other question was to give sort of more tangible examples of how you've helped someone who might have otherwise been on a downward spiral actually now go in an upward movement, because it's not just about like keeping them stable, right? It's about making them even better. Yeah.
Yeah, I mean, I can tell you what we kind of do at Trellus, right? So, the patient has, we kind of assess them wherever they're at, right? And we try to figure out, using that methodology, that assessment tool I was telling you about earlier, and really kind of try to understand where are the gaps and what do they need, right? And then that patient kind of, we also, by the way, are getting all of their disease related information too, right? Because we never separate those things out. So we want to know, how many biologics have you failed? Have you had a surgery? When was your last hospitalization? Because all of those things inform who you are, and they have an explanation as to why you might be having other issues. So we really do this, probably one of the most important features of our of what we're offering is that contextualization of the patient in real time and what we can sort of offer them. And then from there, we can set up very personalized care plans. So like I said before, everyone gets the basic skills, but you can also really work with a coach, work with a nurse educator, work with a dietitian, and also, sort of, like you said, not everyone wants to actually talk in person to somebody. They want to just be able to peruse. We have curated content and modules and reinforcing engagement techniques that can really just help the patient find their way, save their time, not having to look in 20 different places for one answer, not getting multiple answers, really feeling like they're getting the truth about what needs, about their disease, about their mental health. All of this is science informed and evidence-based. So, again, I think it's very easy to take advantage of patients who are desperate with chronic illnesses, and offer them something without really understanding what it is they need. And we can't ask patients to decide what it is they need. I think we can ask them what they think they need, but, part of expert care is telling them, we've seen thousands of people in this situation, and we know what you need to do to feel better and to have more time and to thrive and to flourish.
That's right. Actually, I often tell gastroenterologists that, patients, another very common question, I know this is about this topic today, about positive psychology and chronic illness, but if I had a nickel for every time a patient asks me, doctor, what should I eat?
Yep.
Right. Again, remember in the world of someone with a GI illness. And I think it's unconscionable to tell people, go figure it out, see what agrees with you. And so this is how we create another dimension of food phobias and all sorts of other abnormal behavior, and a lack of quality of life related to food related quality of life. Right.
Yeah.
And so, there's a question that has to do with this, whether a disease acceptance toolkit can help you deal with the ambiguity of illness. And in this case, I'm actually going to ask Angelica to maybe tell us what it feels like to live with ambiguity, or is that how you perceive it? Let me not put words in your mouth. Is that how you perceive it? That
I think for me, knowledge has been powered to some degree, because the more you learn, like the more it could help. But yes, there are some things that you can't predict. I know with my mom, she lives with MS and it's actually progressive, right? So that is a whole other level of acceptance, where with me, I accept that I have the illness. There are a lot of promising treatments. It's a whole I have the ability to really accept the ambiguity of my illness a bit easier, because I know that there is hope and I have reached that point where I am in remission. So I would actually be curious, just thinking of my mom, with an illness that really doesn't have as many advancements or ups and downs, and it's really progressive. Like, I think all the time about an acceptance toolkit for that. So if I could just get in a question of my own, I would love to.
Yeah. I mean, I think acceptance is that process. And I always say, you don't have to approve. Acceptance doesn't mean you're resigning yourself to an outcome. It doesn't mean you're approving of the outcome or the situation that you're in. But that when you kind of are able to accept where you are, you're able to kind of move forward. And that may be, with, progression, how can you live out the rest of your life as you lose function? You don't have to approve that that's happening to you. You don't have to approve that, life is going to change. But to Leona's point around thriving and flourishing and finding meaning and purpose in your life, there's no reason you can't do that.
Right.
Despite. And so, we try to really package this concept of acceptance for what it is. It's acceptance, not approval.
Right.
Right.
And humor has always been a huge thing for my illness and her own. Maybe everyone has other things, but for whatever reason, we really use it often for both of our respective illnesses.
Yeah.
Beautiful. I think, a key feature, so you had mentioned MS, right? I think a key feature so often of these sorts of experiences is what in psychology we would call loss of agency, right? There's so much that you don't have control over. And so it's pretty important to our flourishing to feel as though we do have a sense of agency or control over some aspects. This concept of acceptance and without approval, right? What Lori was mentioning, there's actually acceptance and commitment therapy, right? Which is an approach that focuses on acceptance, right? Really seeing the situation as it is, being able to be at peace with that, because we can invest a lot of energy in resisting it or being frustrated with it. So being at peace that this is what the situation is, and still being able to live in a values-driven way, right? Being in touch with one's own values and strengths as a way of exerting some agency, right, over the situation. I can still have this experience, right, physically, and I can still live by these values that are most important to me. And the two of them can go hand in hand, right? I don't have to be rid of this in order to have a life of control and flourishing. I can experience both together.
Are there aspects then in listening to this conversation that sort of are a common platform across many illnesses, but then there are more kind of specific targeted things? Because you keep saying contextualized, Lori, you keep using that word. And in this context, do you mean that there's the kind of like broad stuff that goes across various illnesses, Angelica's mom with MS, but that also applies for IBD, but then like stuff that has to be more specific for a disease? Is that?
Yeah, and that's exactly right. And that's why we really try not to about IBD and how I'm able to understand the symptoms, the medications, the treatments, the specific medical traumas that are associated, with our IBD patients. Not that somebody else specializing in MS, but this is exactly why if you're just sending a patient out into the community for psychotherapy because they have a chronic disease, they're not going to get what they really need. They might feel better mood-wise or worry-wise, but to not be able to have that depth of knowledge specific to their condition, and then use that depth to apply the skills. I think that is really and medical care versus this combination of both in the same setting.
That sense of efficacy around your own, right, your own particular disease state, right? I can have a sense of efficacy over, I don't know, maybe I'm a great chef, right? Or maybe I'm, particularly good at tennis, right? But being able to have that efficacious experience within the context of managing the set of circumstances that you've been handed, I think is really meaningful. And that is what I see as being super key to that contextual piece. It's very domain specific.
Yeah.
Actually, Laura, there's a good question here that asks whether some of the basic skills that you alluded to within the Trellus platform, if these are based on CBT, or on cognitive behavioral therapy. Maybe you could explain that a little more.
So they are based on behavior therapy. And what that kind of more broadly means is that some of the concepts are through the lens of cognitive behavior therapy, where we work on thoughts and feelings and behaviors. Some are, to Leona's point, based on acceptance and commitment therapy, right? So more of what we call these contextual-based therapies that maybe de-emphasize the thinking and go more towards these values-driven behaviors and goals. Some are self-regulatory, right? So some are around how do we calm our bodies down? How do we sort of lower that autonomic nervous system arousal that's so common in GI disorders, but also in chronic disease more broadly? So all of these are behavioral by definition, right? They are all evidence-based behavioral therapies that have been packaged together in a way that matches what an IBD patient would need, right? And that may differ, right? There might be more cognitive stuff in somebody with MS. There might be, more behavioral stuff in somebody with autism, right? But the idea is that you have this framework all sitting kind of under this positive psychology framework that allows us to really, whatever you kind of need in the moment is what we can give you more broadly.
Another participant has asked us whether what advice you might give to people who are, managing chronic illness, and how to create normal within the workplace with respect to, their illness and incorporating having to take care of themselves, right? Because that's part of the issue, is that part of the medication, part of the therapy, the biologic therapy is, following a circadian rhythm of your body and getting enough sleep for you, which I tell my patients is essential, to have physical activity, sleep, and, eat a healthy diet. That could be another one of these webinars, but to talk about that. But in this context of positive psychology, like how might someone practice self-efficacy by creating for themselves in the workplace, the space to, kind of be able to take care of themselves.
Yeah, beautiful. So I think one of the things, so I'm just going to back down from that just a little bit. And sometimes we have this fundamental assumption that if we take care of ourselves, we are somehow, that's at the expense of our employer, right? That it's a zero-sum game. And if I take care of myself, that's time that I'm not being, that my employer is not getting me as a productive employee. And I just want to decouple that a little bit because I don't think that's true. I actually think it's in an employer's best interests to have an employee who not only is actively engaged in their work, but feels a sense of loyalty to the employer because the employer cares about them too, right? So it's much more symbiotic. I don't want people, I would first encourage people to question the assumption that they are somehow doing some sort of harm to their employer by taking care of themselves. If anything, they're doing something good for their employer by taking care of themselves because they become a healthier and more productive employee. Especially in an information economy, there was a time in employee wellness where we would always track time away from work as being the lost time from work, right? So absenteeism was like the key metric there that we would use around that. And in an information economy, we've seen so many employers that don't offer sick days anymore. It's just this big lump of paid time off, right? Where your sick days and your vacation days are kind of lumped together. And as a result of that, people are trying to, perhaps preserve some of that time and minimize some of their time away from work. So the thinking has gone away from time lost from work to time lost at work, right? Because there can be times when you are suffering so much that it's impossible to keep your mind focused on your work. So again, I just want to encourage people to question that thinking that somehow their well-being and their employer's well-being is a zero-sum game. Sometimes we get into that sort of dichotomy when it comes to happiness. Somehow we think that people, when they are pursuing happiness, are somehow just, they've taken their eye off the ball, right? That they can't be serious at work or something like that. All of the evidence points to the fact that happy, flourishing people are more productive. They get more promotions. They earn more at work. They offer more in terms of what they're able to do. So it is a non-zero sum game, right? It's a mutual win for your workplace for you to be able to take care of yourself. And so, if anything, I just want to give people permission and freedom because you're on your employer's side when you take care of yourself. It's really, really important.
Maybe you could have the last word, Lori, about some of the aspects of Trellus and how it's tailored to a particular population of patients, and some of the effectiveness of this strategy.
Oh, just even kind. Can you hear me?
Yeah.
Okay, good. Okay. Even just when you think about all the IBD patients, but this is, down the road, this applies to any kind of really chronic condition in which somebody has to be able to take care of themselves long-term over time and be productive. And, I think that having something powered behind you that keeps you accountable, keeps you on track, you have a place to go, really allows you to be a better employee, allows you to show up as a parent. And I think that's what we're really trying to do at Trellus, which is to give people the time back to be able to do the things that they actually want to be doing and not floundering around all the things that they don't know how to manage or can't manage efficiently, right? And I think it's just a very all of us need to care about that, right? Whether we are an employer, a payer, a patient, a caregiver, I think that is really sort of when all of us agree that these outcomes are important. And to Leona's point, happiness is important. Happiness is a goal that leads to all the other things that we care about.
That's great. Well, I think, we're at the top of the hour. And so I'm really very grateful to a wonderful audience that has sent us terrific questions and kept us on our toes. Angelica, for sharing this very important story with us that resonates in terms of chronic illness across the board. Leona, for introducing me personally to this whole new way of thinking. And Lori, as usual, you have so many brilliant ideas related to IBD and behavioral psychology. So thank you so much for all of you for joining us. And as you know, this has been recorded and you can watch this later as well and recommend it to your friends. Thank you.
Thank you to Maria and all of our speakers. Please visit our website at hlth.com to catch up on all Health GoLIVE webinars. And join us in Las Vegas, November 13th through 16th for Health 2022.